Acid reflux is a normal occurrence. The lining of the stomach produces acid, and it's the beginning part of a cascade for digestion. Occasionally, the esophagus will accommodate some of this acid, especially after eating, and it's a normal occurrence for everyday people. It's not until we talk about patients that have pathological reflux is when that reflux occurs at an abnormal amount of time, or they're exposed to an abnormal amount of acid. The biggest cause for acid reflux in our country is actually obesity. There are several factors that can cause reflux, but in this country, obesity tends to lend the biggest problem. Really, what happens is nature has given us a reflux barrier that incorporates 4 different components, and being obese obliterates all 4 of those components, and so we lose the ability to prevent reflux as nature provided it for us. And so losing weight is usually the first thing we tell patients that have bad reflux. Other reasons that would cause it are patients that are just given a bad muscle. Genetically, they just were born with a weak muscle that just will not stop reflux. Weaker tissues and things like that predispose them to herniation. And so a hiatal hernia is another cause, which are typically found in obese patients, but we can find them in other patients also. And so all these factors are reasons for patients that can get reflux disease. Any person is at risk for reflux disease. Typically, the obese patients are at the highest risk, but it could affect anybody. The most common thing that I see in my practice is patients that have hiatal hernias. And this means that the stomach creeps up into the chest and they lose their natural reflux barrier. Somewhere between 30 to 40 million patients across the US are affected by reflux disease, which causes a high dependency on acid-suppressing medications such as Pepcid or Nexium or things like that. The age group typically for reflux could be across the board. I see patients that are in their 20s that have reflux. Even infants experience reflux. However, nowadays we're treating patients with medicine, and they don't get to any type of surgeon or definitive care until later in life. And so the typical patient that we see in our practice is patients over 50 years old, sometimes even 60, 70, or 80. And that's usually because of a really large hiatal hernia or they're failing medical management. Managing reflux disease, the first thing that I tell patients is their lifestyle modifications. So I have them change what they eat, and usually lose weight will affect their reflux. Typically by this time we start patients on medical therapy, which can be over the counter, and then there's a subset of drugs that have in the past only been prescription drugs called proton pump inhibitors. These are drugs like Nexium, Protonix, things like that. Now, most recently, those have now become over the counter, and so we can get them over the counter, but those are usually the end of the line for medical management. And typically what happens is these patients will use them and continue to have symptoms despite their taking these medications, and will double their dose, and then finally they have completely worn out the medication, and then oftentimes don't know that there's something else that can happen. Since the invention of medical therapy, which originally started back in the 1970s with proton pump inhibitors, we've noticed that in that 25 years leading up to the turn of the century, the rise in esophageal cancer has gone up almost 700%. And so correlating that back to when patients started taking these PPIs, we're starting to find out over time in long-term studies that patients that have been on PPIs for a long period of time can be predisposed to cancer development. And so we start watching these patients more. In fact, any patient that comes into my clinic gets a screening endoscopy, and they get biopsies of the area that are affected by reflux, looking for changes that are significant or potentially progressing on to cancer. Patients that come into the clinic that have failed medical management can be candidates for surgery to fix their reflux. And nowadays there's several options for patients, including things that are less invasive to maximally invasive. And one of the main things that we try to do is fix their hiatal hernia. That'll generally help with their reflux altogether. And so repairing the hiatal hernia usually will decrease their need for these medications and essentially stop their need to be on any more medical therapy.